Roberto, and we picked a chiropractic as our career project. And so, first off, chiropractic are healthcare professionals who treat problems with muscles and nerves, especially in the spine area. They use hands on techniques and adjustments to help reduce pain and improve movement. They also teach patients about posture, exercise, and healthy habits to have to prevent future issues and overall wellness.
And some issues chiropractors see often are like scoliosis, any misalignments, hip issues, like pain shooting down, neck pain. Those are some common issues they see on a regular basis, and yeah.
Educational requirements to become a chiropractor requires about 3 years of college level courses and at least 90 credits. After that, students can enroll a doctorate program for a chiropractor, which takes about 4 years. So overall, your education timeline will be about 7, 8 years.
All right, and this is a admission requirement by Southern California University of Health Sciences. So students need at least either 90 credits, 3.0 GPA or higher, and have taken anatomy, physiology, and chemistry courses with a grade C or higher. Or you can either go the bachelor's degree route and then also have your courses as you have your required courses done as well. So yeah. And certificate requirements. So in order to become a chiropractor, students have to complete a series of exams. The exam is called the National Board of Chiropractic Examiners. That consists of 4 parts, and throughout their doctoral program, they'll complete those tests. And the last part is taken after they graduate from the program, and then after that, they have to apply for their chiropractic license. And requirements vary by state and country. This may include another exam called the jurisprudence exam, and there's a license fee also required for that.
Average annual salary for a chiropractor depends on what state you live in and what country you live in. But for America, it's approximately $90,000 per year, and taxes and fees are included, especially in California. So in Florida, your average annual salary is approximately $86,000. In Texas, it's about $95,000, and in the state of Nevada, which we are all in, you make about approximately $108,000 per year.
All right, and we'll be playing our interview.
Dr. Ray, thank you for having us today. We're going to be asking you a couple questions about your background and career. And so the first question is, what inspired you to pursue a career in chiropractic care? Were there any other professions you were interested in at first?
Yeah, for sure. Well, I was interested in both physical therapy and chiropractic. And it was actually my physical therapist at the time, and this is in Canada. He's like, do you want to make money or do you want to help people, or do you want to do both? And I was like, well, I do both. And he said, chiropractic, because you can do everything, a physical therapist can do it and more. And there's a much higher ceiling, and you're able to help more people in less time. And so that sold it for me, and so then I was all in on chiropractic. But really what got me into chiropractic was because I had scoliosis. I didn't know about it. It was like pinching off nerves going into my stomach. I was having digestive issues, couldn't figure it out, and seeing all these doctors. And finally, the chiropractor told me I had scoliosis. There was pinched nerves going into my stomach. And so once I started getting that back, then I started getting adjusted, and I started getting better. And I got off all medications. And so then I was like, I definitely need chiropractic now.
Next question, what has your career journey looked like so far?
Well, as I started off at an office injury rehab as an associate, we just ran out of school, and worked there for about a year, and started my own office, or own practice within that office, only for another 2 years. Then I branched over to this office, and then just rented these 2 rooms, and I've been there for about 2 years. And now looking at getting my own building, my own place, so super excited about that. Will be coming in the next coming months.
Yeah, congrats.
Thanks.
And tell us a little bit more of a chiropractor. What is constant?
Gauss is a very specific technique. You take full spine X-ray, it shows exactly what's off and where to fix it. And we're very specific with the way we adjust. We try to move one spine at a time. That way we can see what our motor can work. Typical chiropractic is more of a shortcut approach, right? Same set of moves on everybody. And that works 80% of the time, but then there's that 20% where there are really difficult, complex spine issues that aren't going to resolve with non-specific care, and that's where advanced I think comes in. And you can really build a practice on some of those patients that are in tough that no one else can help because then they'll tell everybody.
Next question. Are there any emerging tools or technologies changing how you work?
Well, one thing we just got is cold laser that's been helping a lot with like tendinitis, shoulder issues, knee issues, jaw issues, these lingering issues that patients have been having. It's helping to move the needle again and get them better. So that's, I think laser is the future, you know, and healing just speeds up healing. It works really, really well with the adjustment. So.
Most challenging part of your job?
Most challenging part of the job? I would just say it's probably just like showing up every day and, you know, trying to really help people and trying to block other things that might be going on in my life and just concentrating on the patient in front of me, you know, and just really trying to be present. I think that's probably the hardest part.
Yeah, definitely so. And what are some key skills or certifications that are most important to you in this field?
Well, I think obviously you gotta have the chiropractic degree, you gotta get your jurisprudence, allows you to practice in your state. But I got a Gunstead certification, you know, in extremities, that's been super helpful because it needs everything, noses, you know, whatever, just jaws. And then also I did some CUPs in chiropractic biophysics, which allows me to actually correct the spine over time. So I think that's been super useful. A lot of the seminars and courses that you'll take out of school are really, really helpful as well.
And building from there, are there any courses, books, or resources that you recommend to someone interested in chiropractic?
Yeah, for sure. I would, you know, especially if you're thinking about doing Gunstead, which I recommend everybody read the Gunstead chapters. It's a whole textbook on the whole Gunstead technique. I think that's awesome. I'd probably anyone start there.
Yeah. And what advice would you give someone starting out in this field or interested?
Yeah, I think just have fun with it, and you know, I would do what you guys are doing now. Just learn from chiropractor, get into an office, try to get your hands on as many people as you possibly can. Start adjusting as soon as you possibly can, because it just takes time. You know, so it takes like 10,000 hours or 10 years to really master and practice to master the adjustments. So the earlier you get started, the better. Even if it's just massage or even if it's just feeling the spine, you know, just get really good with your hands and then talking to people. You'll be able to communicate.
Well, that wraps up our questions, Dr. Ray. Thank you for having us and sharing your time and insight. Is there anything else you'd like to say before we wrap this up?
No, just follow me on all socials, Restore Chiropractor, Instagram, TikTok, Facebook. Thanks for having me.
Thank you.
Alright.
Well, Dr. Ray, thank you for having us today.
Alright, and the peer review article. So the article we chose was from the UNLV Library website search, and the title is Management of Patients with Prior Lumbar Fusion, a cross-sectional survey of veterans affairs chiropractors' attitudes, beliefs, and practices. The authors of this article is Clinton, Jordan, Edward, and Anthony. Their hypothesis was self-reported management approaches and practices related effects on the management of patients with prior surgical lumbar fusions among U.S. veteran affairs chiropractors. And the general design included strobe guidelines, ethical approaches, electrical surveys, statistical analysis, and quantitative analysis. And the results, 62 out of 134 chiropractors responded, and 90% of them saw at least one patient with post-fusion in the past. And common treatments included healthy lifestyles, pain education, exercise prescription, stretching, and soft tissue therapies / modalities, and evidence-based practices of this would be that for the future, they can help shape the guidelines and patterns of the post-lumbar fusions of patients. And this is our references. And
That's
thank
all.
you.
Thanks.